evidently, lupus can take a toll on your mental health. And I remember seeking mental health help from various people, kept trying what would work for me. And and I also remember you telling me how it has a link with fibromyalgia, your stress factor.
Yeah,
and
yeah.
On a lighter note, if you have lupus, it's a buy one get one free. You get fibromyalgia along with it. Majority of us have it. How do we handle it?
As you said, but it's not that every lupus patient has fibromyalgia, but significantly 30 to 40% of lupus patients have fibromyalgia. Fibromyalgia is just, it can be said, just aches and pains, but the person who is perceiving it, it's a person who is affected with fibromyalgia. It's a very bad disease to have. So, because until it is diagnosed, they will complain of vague aches and pains and headaches and dysmenorrhea to sleeplessness to tummy disturbances to what not. Because it is a problem with the nerves, nerve perception of each sensation. Most of the time people are really having tough time dealing with it, and most of the time fibromyalgia is associated with depression and sleeplessness, etc., etc. But thankfully now at CARE we have formed a team. You know that you have taken their help with the physios and a pain psychiatrists, pain psychologists. These people together, along with the control of proper lupus and getting back to normal life, the fibromyalgia comes down to a great extent. So, once you have a diffuse aches and pains, despite getting lupus under control, most of the time you have associated fibromyalgia or hypothyroidism or thyroid deficiencies or vitamin D deficiency. So, before diagnosing fibromyalgia, you have to rule out certain things like this, and then you diagnose fibromyalgia. But again, fibromyalgia can be very well treated, and it is the advantage of fibromyalgia never kills somebody. Like lupus can kill, but fibromyalgia usually affects their quality of life, the way how they live. So, basically fibromyalgia can be treated, but having fibromyalgia along with lupus is additional burden. So, you need to identify that fibromyalgia can coexist, then treat it.
You already emphasized on the importance of familial support, but now I want to ask about marriage and pregnancy. We have seen patients who have wanted to get married, but tend to hide it from the in-laws or tend to hide it from the related family members, distant families. And it's only when a miscarriage happens or something like that happens when they're at the spot, and that triggers.
Yeah, see, basically most of the time what happens is all our patients who are from 1820s, they come and ask us whether I can get married. The answer is yes, but you have to find a suitable partner. That's extremely important, who understands what you have, whether you can have a normal family life. I say yes, you can have a normal family life, you can have kids, you can lead a normal family life in most of them. But there may be ups and downs. As you said, lupus can, after some time of remission for 4 or 5 years, suddenly there can be a small increase in disease activity. Somebody can develop a proteinuria at a later date, kidney involvement can happen. So, you need to be under constant monitoring. And during pregnancy also there needs to be adjustment of drugs which needs to be made. So, it is extremely important that you communicate with your whoever would be partner that I have such a disease, this is I am getting treated, and then have a discussion with him. And most of the time they husband or wife accompanies the patient and they have a frank discussion with the doctor. A lot of them bring them along with them, and we tell them this is the disease, she has lupus, most of the time now the disease is under control and she needs to take drugs for a long time. What happens if somebody hides? It is a mental trauma on the patient that I have cheated somebody, I have got married without telling this disease diagnosis, then that, and they have to hide the drugs, they have to take drugs very secretly, they have to seek the treatment very secretly. So, there are a lot of challenges. So, it is best to be open of the diagnosis, and what I have seen is that if you tell, there may be 5 proposals which gets cancelled because of this, but the 6th one will match. And most of our lupus patients are able to find a match of their choice, and once they are open about it, there will be some good soul who have something else, and most of the time they match. And what we have seen is that lupus patients who find a good match after revealing the diagnosis, if the things go all right, even if a flare happens, the husband's family also supports them. And what I have seen is that some of them come and tell me, if I marry some girl, it is possible that at 5 years down the line she can develop a disease, then also I have to take care. So, I am very happy that they are open at the beginning. and the husband's family are also really supportive. So, it is extremely important to be open about the diagnosis, discuss with them the challenges, and that you have at least you have to discuss that. You need not tell the entire family by calling a meeting that I have this disease, I have this disease, I have to take these drugs, are you okay? But with the immediate family members, you have to be open about it, that I have lupus, I have disease. Even if they don't understand lupus, I have a disease, I have to take a longer time treatment, and it is extremely important for the husband to understand what are the finer nuances. So that they can help them fight it out.
On this note, I'd like to invite everyone for the Lupus Day event that's happening here at Kochi. There'll also be a blended event that will be happening online. So we are hoping to have maximum participation from patients, their families and their friends and the support system. Thank you, Doctor.
Thank you.